Cesarean section, C-section, or cesarean birth is the surgical delivery of a baby through an incision made in the mother's abdomen and uterus. There are two types of C-sections. One is scheduled for a certain date and time. The other is after the mother's been laboring for a period of time and a C-section is required for a last-minute delivery due to possible complications. Healthcare providers use this method when they believe it's safer for the mother, the baby, or both. Some common issues that could cause distress and require a physician to perform a C-section would be the baby's position. A C-section may be required when a baby is breech, transverse, lying sideways, or if the baby is face first instead of head first. Prolonged labor. Labor that continues without progress can result in umbilical cord problems or placenta problems. Placenta problems. An abruption or abnormal pulling away of the placenta. Cord prolapse. This is when the cord is being delivered before the baby. Hypertension. Infection. Previous C-section, especially if you've had a previous C-section with a vertical incision instead of horizontal. Multiple gestation. If you're having multiples, a C-section is required. Prior to a C-section, the patient is required to have an IV, lab work and fluids, antibacterial skin wash, and some antibacterial wipes used to clean the abdomen from any bacteria that may be on the surface of the skin. Pre-op medications. These are to help decrease stomach acid and also provide some antibiotics to help prevent infection. Foley catheter. This is usually done after the spinal if at all possible. The catheter is to help keep the bladder drained for surgery so the nursing team can keep track of kidney function. Compression hose on your lower legs. This is just to help keep circulation going during surgery to help prevent blood clots. Shaving of your pubic hair. Your labor nurse will be with you the entire time and provide support and guidance. Your support person can also be with you during delivery. Other team members you may see include an anesthesiologist, technicians who help your OB, and nursery staff. Your nurse will listen to your baby's heartbeat, apply monitors, clean your abdominal area, and if your water is broken, you may have a vaginal prep, which helps decrease bacteria. Blue drapes will be hung to keep things clean for surgery. This drape will hang in front of you so you won't be able to see the physicians as they work. While the OR may feel intimidating, your nurses will keep you informed and provide any support needed. A C-section delivery usually happens quickly once the OB begins. You may feel tugging, pulling, or pressure, but you should not feel any acute pain. Once the baby's delivered, the delayed cord clamping occurs for 30 seconds. Then the infant is handed off to the nursery staff for assessment. Your support person will be sitting beside you and will be able to take pictures as they clean your baby, weigh him or her, take footprints, and other post-birth procedures. Your support person can take as many pictures as they wish. Once you've had time to see the baby, the nursery staff and your support person will take the baby back to your room and wait for you to return from surgery. Skin to skin will be initiated once you get back to your room. If your support person wants to do skin to skin while waiting for you, this is also an option. Have that talk before you come to the hospital. Pain relief after a C-section will depend on the type of anesthesia used. You'll be given a long-acting pain medicine called Duromorph. If you have an epidural or a spinal anesthesia, you would have oral or IV medication for breakthrough pain as needed. If you have general anesthesia, you can expect to have a PCA pump, which is a patient-controlled pump that allows you to give yourself pain medication through your IV. If you receive a spinal tap, you'll be asked to lie flat for about 2 hours or until the spinal wears off. This will prevent a spinal headache after delivery. An incision dressing will cover the area and the nurses will periodically assess the bandage. If you have a regular doctor's dressing, it should come off in 24 hours. After the removal of your bandages, you'll be allowed to shower. If you have a special dressing for infection prevention, the dressing usually stays on for 7 days, but possibly longer. You'll still be able to shower with this type of dressing, but you should not attempt to alter or remove it until your physician tells you otherwise. Your nurses will be sure to let you know what type of dressing you have. Just like with any vaginal delivery, your nurse is going to be assessing your fundus, or the top of your uterus, and massaging the fundus to help control bleeding. They'll be assessing the height and location of your fundus at 15 to 30-minute increments after your surgery. Following a C-section, your diet will consist of clear liquids and progress to solid foods as tolerated. The Foley catheter will stay in for about 12 hours before it's removed. Once post-surgery criteria are met, then you'll be allowed to transfer to the postpartum unit. With any surgery, infection can be a risk. There are some things you can do to help prevent or decrease that risk. Wash your hands. Wash your hands before touching your surgical incision or before touching your dressing. Wash your hands after using the toilet, sneezing, changing the baby's diaper, or if you've touched pets, garbage, or anything in a non-sterile environment. Wear clean clothing over your surgical area. Putting on a clean gown or shirt daily can help reduce your chances of infection. Sleep on clean sheets. If you lounge on a sofa or a couch, cover the surface with a clean sheet. Use a clean washcloth every time you clean your incision area. Avoid allowing pets to have close contact with your incision area, making sure you're not allowing your pet to sleep with you while your incision is still healing. Always use hand sanitizer. Just like with any surgery, there will be pain following your C-section, especially when you cough or do deep breathing exercises. You need to continue in order to keep your airway clear and decrease the risk of pneumonia. You'll have pain when moving, but ambulation is important for circulation. The more you move, the more it helps decrease the pain. There can still be vaginal bleeding after a C-section. You may even have some cramping. Just keep up with the amount of bleeding and the severity of your pain. Let your labor team know if what you're experiencing seems abnormal. The length of your hospital stay after a C-section is generally 48 hours. Should you want to attempt a vaginal delivery after you've had a previous C-section, your OB would review your records and see if you're a candidate to try VBAC. The term VBAC refers to a vaginal birth after cesarean. There are risks associated, but your provider would review those risks and benefits to see if a VBAC is possible for your delivery. It's important to prioritize your health and the health of your baby. Don't hesitate to contact your healthcare provider if you have any questions or concerns. Your obstetrician gynecologist is committed to supporting you throughout your journey. To learn more about Forrest General Hospital's Women and Children's Services, visit www.forrestgeneral.org/women.